welcome to Distinction Cast, where ADOM showcases the best and brightest minds in the dental industry from within our Dental Management Association. Distinction Cast is more than just insights into dental management. We amplify the voices of ADOM's distinction holders, leaders in the trenches of dental management, who share insights, inspiration, and real-world strategies to help you thrive in your practice. Before we dive in, a special thank you to today's sponsor for supporting this episode.
Cedar is proud to be ADOM's official HR partner. We know managing a team can feel overwhelming, and that's why we're here, to empower office managers like you with expert guidance for navigating the challenges of running your practice. Our team of HR and employment law experts is passionate about supporting ADOM members. From answering tough employee questions to provided unlimited phone and email support, we're your trusted resource for team management solutions. We don't just help you create a custom employee handbook tailored to your practice. We show you how to use it as a tool to make your day-to-day operations smoother and more effective. With Cedar, you're never alone in tackling employee issues or building a stronger, more successful team.
I am super jazzed to welcome back Stacy Singleton to Distinction Casts. Stacy holds a business administration degree from Hesser College and is the practice administrator for Harborside Dental and York County Pediatric Dentistry in Wells, Maine. A diplomat of ADOM in our distinction holders, she founded and led the Maine Dental Leadership Coalition. With a dental career spanning since 1997, she's a certified dental assistant, an EFDA, which we'll talk about today, and dental director at a local dental college, overseeing dental assisting and EFDA programs. Recognized for excellence in office culture and management, she was a 2016 Dental Assistant of the Year runner-up and a 2023 Dental Office Manager of Distinction. Welcome back, Stacy.
Thank you. Thanks for having me. I am thrilled to be here and share this today.
I'm so excited for you. And this topic, so EFDA, Expanded Function Dental Assisting,
yes,
it's a huge hot button right now for all dental managers and within the dental industry to really help beef up the schedule and our patient flow. And I can't wait for you to share everything about EFDA with our members today.
Yeah, thank you. This is definitely my passion. This is my niche. I love it. I love teaching it. I love watching the progress of the students and following them for years and just the growth that they've had and what they've brought to the practice is huge. And the doctor feedback is extraordinary, for what they can do to a practice. So it's very exciting. And I'm excited to get started.
Well, hop right in. The floor is yours.
So for just a little background, an EFTA is an expanded function dental auxiliary or assistant, and they can be kind of a backbone to a practice and help move forward with increased production and workflow. Depending on what state that you're in, depends upon the certification and the additional training that's required. So in most states, you need to be a CDA through Danby, so a certified dental assistant, or a registered dental hygienist to be accepted to an EFTA program. So I can speak for my EFTA program that you have to have one of those two components in order to be accepted to the program and have at least 2 years of working experience beyond that licensure. And then from there, all the programs differ in length of time and what they're doing within the program and expectations. But once you finish and you get your board state, licensure, then from there, the skills that you can do to bring to a practice are phenomenal. It really equates to having an associate in a dental practice. So if things are done right, you can progress the practice substantially. So we will kind of move on here. And the first and foremost is the legal scope of practice for the EFTAs. And they can perform tasks that go above and beyond the basic responsibilities of a dental assistant. So depending on your state regulations, you do need to check and make sure everyone looks at the scope of practice under your board licensure. Before hiring an EFTA, you want to make sure that they have their credentials. And I always like having them show the skill set as well, because you can have your licensure, but if you're not utilizing the skills, you can definitely lose those. So you want to make sure that they have all of their licensure up to date. And then you want to make sure that the doctors on staff are completely on board with utilizing an EFTA. It can be difficult because they have to let go of some of the responsibility that they're used to. They have to be able to get up and walk away and have an EFTA come in and finish the restoration. So they have to have a huge amount of trust that encompasses the relationship between those two. And that is first and foremost what I always talk about in class and with consulting, is that it's the relationship between the doctor and the EFTA is the foundation of making this work. So moving on. So the state regulations and guidelines for each state, I'm going to list some different duties that EFTAs are accepted in my state to do, and surrounding states, they differ just a little bit. There's a couple of gray areas, and when there's a gray area on what's allowed, it always comes down to doctor supervision and what the doctor is comfortable with. Because something we have to keep in mind is that an EFTA always works underneath direct supervision of a dentist. So anything that they're doing falls under the dentist's license. So that's why that trust and that relationship has to be very important, because any procedures at all that go well, go bad, it all falls under the doctor. So, all right. The most common practices that I see successfully use EFTAs are general practices and pediatric practices. That's been the most successful. I would love to hear from people that are using EFTAs in other types of practices, but those are the two that I see most worthwhile. So here I have listed some of the common EFTA duties from, these are things that are basic dental assistant duties, all the way up to some of the EFTA duties that can be delegated. So as we go through the list, something to kind of keep in mind is that each one of these procedures have a correlating code that can be billed out. And obviously that code is affiliated to a fee that can bring in profit to the practice. So knowing your codes and knowing your fees is super important. When you can productively utilize an EFTA and delegate these tasks, code it correctly, you can increase the profit of the practice easily by 25% if you can do the scheduling and the coding correctly. It is a little bit to figure out. It's a little bit of juggling. Sometimes it is trial and error because it comes down to the practice workflow and finding the right fit for your practice. And not every practice runs the same, and not every doctor is going to delegate the same. So this is very personalized to each practice and how your EFTA is going to be utilized. So coming through the list, we have basic registering patients, obtaining medical history, they're charting teeth, they're doing their vitals, you're doing a perio screening exam. This is definitely for the RDHs that have their EFTA license, because for EFTAs, they're doing procedures that are reversible procedures. And if you want to think of everything from the gum line up is an EFTA. And then if you're an RDH EFTA, you can go subgingival. So some of these things pertain to the RDH EFTAs as well. As we're moving down the list, the soft tissue exam, those things would be an RDH EFTA. And then we're jumping into providing OHI, coronal polishing, fluoride varnish, applying the desensitizers, the etchants, the sealants, caries risk assessments. All of those things are huge preventative codes. They're huge in bringing in production to a practice and providing the dentistry that is needed, especially in pediatric offices. There's such a shortage, I know, in this area of dental hygienists. So in a pediatric practice, if you have an EFTA, you can really expand what you're able to provide in dentistry. So I have a lot of pediatric dentists that are utilizing EFTAs as a hygienist in a practice, and then they come over and will do any scaling that's needed, anything that the EFTAs cannot do. Otherwise, they're doing everything else during that visit, which is huge. It's huge, and it offers a lot more dentistry to be, seen throughout the office. So we kind of call those preventative EFTAs that are utilized that way. And a lot of the people graduating from school and getting out into the workforce, they know ahead of time that that's what they're going to be doing, is utilized as a preventative EFTA. And then we have the restorative EFTAs, and those are applying bond, doing your bases, your liners, making sure that any isolation techniques are done. And then they're placing all the matrix systems, they're filling the tooth, and they're also then making sure that they're checking the occlusion, they're polishing, doing bite registrations. We'll kind of skip over here, and they can be placing the cord, removing sutures, placing perio dressings. They're fabricating temporary crowns, removing crowns. In pedo and ortho offices, fitting and cementing stainless steel crowns, doing all of the ortho procedures, and that's huge. Because they can do bonding and remove bonding and everything like that. When you have Invisalign cases, your EFTA can really do 90% of the visits in a practice, because that's within their scope of practice. As long as a patient doesn't need IPR, so the interproximal reduction, if that's not needed, then the EFTA can see the patient for those other visits. So that can be hugely utilized in an ortho and general practice as well. Doing all of the scanning, constructing custom trays, fabricating S6 retainers, placement of attachments, doing the direct bonding of brackets, cementing the ortho bands. And then, of course, we talked about checking the occlusion and adjusting. They're placing separators, placing and removing the arch wires, the ties, assisting in the administration of nitrous. Again, you have to check on your state regulation for this, because there's a difference between monitoring nitrous and administering nitrous. So please check on your scope of practice for that. And then emergency restorative procedures. So this is an important one as well to look into, because you can have an EFTA cover emergency call, and depending upon, again, your state regulations, they can see patients on an emergency basis. So that's definitely a protocol that you would want to talk about with an EFTA. A lot of dentists like having that extra time that they're not getting the calls and having to see an emergency off hours. And then tooth whitening. So this is also a big revenue boost for an office, and it's something that, an EFTA can do very easily. And these are just some sample procedures that can be done. And again, each procedure, there's numerous codes that can go with each one, especially with the restorative, obviously. So a little bit about the benefits of having an EFTA and collaborating with one is that it definitely enhances the workflow efficiency. Delegating advanced procedures to them, it reduces bottlenecks in the schedule. The dentist can come in, focus on the high complex cases, while the EFTA is doing and managing all the other routine, restorative, and preventative things in the office. It improves patient care. The patients benefit from faster treatment with seamless handoff between the team members. There's a collaboration ensuring all aspects of the patient's oral health are addressed comprehensively. So I'm a firm believer in, more eyes are better. So when you have multiple people seeing a patient, you can pick up on things that may have been missed. So that is very utilized. It has high team morale. It clearly defines roles. And the biggest thing I recommend is when either you have an EFTA or you're bringing on an EFTA, you want to make sure that you sit down with a job description in detail, because you really should be treating them as if you're onboarding an associate, because they're a provider. So you have to kind of have that mentality. And your team members are going to feel valued. They're going to have input, especially when they see someone going through school and they're seeing the growth and what it brings to the practice. They love it. It's good communication within the team. And the fourth is practice growth. You're going to see an increase. It does take time to show that, but it's very efficient to have someone on staff. And again, this isn't for every practice. It has to be the right fit. It has to be the right relationship. But when it works great.
Ready to see the rest of this Distinction Cast and elevate your skills? Join ADOM now to access the full content and a world of resources.